the journey of cerebral palsy.
So I had a rough time during my pregnancy. I was bleeding and all that, but this pregnancy moved to 10 months. When my grandma came to visit, she was like, why is this baby at 5 months still the head is? It's wobbling.
Yeah.
Why? So she was like, I think you should go and check it out. So we were like, okay, fine. We went to a doctor. That's the first time we had cerebral palsy. And we were like, maybe it's a hormone, it's something. We never looked into it. This week we're in hospital, this week she's okay, the next week we're in hospital again. So it started reoccurring. So the doctor we went to told us, we've given this child antibiotics that are impossible. Can we please go to a main hospital? That's when we were told to go to Kenyatta.
You couldn't sit unsupported. You had to put some cushions to, So that was another concern.
God won't give you a task that you're not capable of handling. So if you find yourself in a situation like this, please take heart. Be encouraged.
It's not time to give up for these little ones. It's time to hold on and soldier on. Parents who have left their partners because there's a cerebral palsy, it is wrong to leave your partner. We have seen a role model family of Mama Becky and the husband who has stood with her through the journey. It is not easy. No one will promise you it is easy, but we are going to be there for you. The medical fraternity, the clinical people will stand with you and support you through the journey.
When a child is born, every parent dreams of a first step, first words, first celebrations, and many firsts. But for some families, those milestones look different, slower, harder, delays, and sometimes uncertain. Today, we open a conversation that many live through, but few truly understand this concept, the journey of cerebral palsy. I hope you've ever interacted with that concept of cerebral palsy. Today in the studio, we have the parents of a child with the cerebral palsy, and we have them here, our guests, Pastor Yulene and Ronald. Welcome to the Better You Show. I'm going to introduce you in a better way as we move forward. Now, today we also are joined by the nurse. She's called Maureen. She's been taking care of their child, and their child name is called Becky. So I would really urge you to stay tuned so that you can be able to learn about cerebral palsy. Now, ladies and gentlemen, I'm your host, Sianto Kekayaya, and welcome to the Better You Show. This is the platform whereby you get to interact with information that is credible, information from experts. And why is that important to you? Is because you can actually start applying what you learn here in your day-to-day life. And what will happen? You'll become a better version of yourself. Thank you so much for joining our community, and for the ones who have not yet joined our community, I encourage you, I'm asking for a favor, take a second, 2 seconds, just click subscribe to the Better You Show on YouTube and you'll become a member, and we receive you with so much love. Now, usually in our studios at the Better You Show, we usually have two traditions. Yeah, we love listening to the Word of God. We love to play before we get into the heavy conversations that we have today. And with that in mind, let's take the word of the day, which comes from the book of Psalms, chapter 46, verse 1, which says, God is our refuge and strength, an ever-present help in trouble. So this verse or this scripture is there to encourage us that during those days when we feel heavy, when we feel that those appointments to the doctors overwhelm us, or even when the progress of healing seems slow, or even when we are pressed in terms of our resources as we take care of the ones who are sick, the Lord is saying that He has not left you, He has not left us. He is walking with us in this journey. We just need to trust Him, we just need to welcome Him in. Lord, help us. Lord, on our own, this really looks like a very challenging and heavy journey. So I would urge each one of you, and even me, plus our guest, to really have that at the back of our minds. Now, we are going to engage in some form of play, as usual, through a tongue twister. Pastor Yulin,
yes,
you have a paper in front of you. It's
yes,
a tongue twister challenge. So what you're going to do, we will start with you first, and then we are going to clap for you, or we are going to laugh at you, whichever that comes, depending on how you you take it on. So you have 2 trials attempts, right? So you can read them as fast as possible. Actually, we do this so that we have fun, and also so that you can call your English teacher.
Wow.
Yeah, after this show. So
that's a good one.
So are you ready?
Yes, I am.
All right, take it on.
Stiff joints, struggle, soft stretches, suit, steady steps, strengthen, shaky stance.
Faster, faster, faster.
Stiff joints, struggle, soft stretches, suit, steady steps, strengthen, shaky stance.
We got you right there. How did she do it?
That one was easy for her.
That was easy for her.
Yeah.
Now, Ronald,
Yep.
you have a tongue twister in front of you.
Oh, it's the same.
It's the same.
Okay.
So he's gotten some leakage, eh? Yeah.
Okay. Give it a go.
Yes.
Stiff joints, struggle, soft stretches, suit, steps, steady steps, strengthen, shaky stance.
Fast and faster.
Stiff joints, struggle, soft stretches, suit, steady steps, strengthen, shaky stance.
How did Mr. do?
He's very calm and collected. Stiff
Yeah.
It's an awesome one.
Stiff joints, struggle, soft
idea.
stretches, steady steps, strengthen, shaky stance. Wow. Okay.
Good thing that you didn't have any R's and L's.
I should have put R.
Yeah, yes.
Yeah, next time I will. Or for the nurse, I'm going to put for her R.
R and L.
Yeah. Now, from this tongue twister,
Yes.
stiff joints, struggle, soft stretches, soothe, steady steps, strengthen, shaky stance. How is this related to the journey of Becky with cerebral palsy?
Wow.
Any one of you can go, like stiff joints, struggle,
Yeah.
soft stretches. I don't know if there are times when
Yeah.
maybe when you stretch Becky, she feels soothed.
Yeah. But it applies. It applies very much to her condition because one of the things that we realized when she was young, what made us realize there was an issue was actually some of the things you're talking about here, because she'd have some uncoordinated movements, like jerking movements sometimes.
Yeah.
Sometimes also should stiffen, like her arm should really come stiff.
Okay.
And so those are some of the things we noticed early on,
Yeah.
and that made us start questioning what could be the problem. Yeah, definitely. So it makes a lot of sense to our
Thank
discussion
you for
today.
finding that connection.
Yeah.
Pastor Yulin?
Soft stretches suit. It has really stretched us. Because in a lot, just trying to see a child who was speaking, maybe not speaking, a child who was seeing, not seeing, a child who was hearing, not hearing, a child who used to move, maybe who used to jump, now she's not jumping, she's lying there. So it has stretched us in a point of that, even in this storm, we are peaceful and looking unto God. So it has stretched us.
Okay. Wow, thank you so much. Now, my viewers, allow me to introduce our guest. And the beautiful lady you're seeing right there, she's called Yulin Muhando Kamau, and this is the husband. the parents to the child with cerebral palsy. Her name is Becky. So we call her Pastor Yulin. We actually fellowship together at the Well Church, and she's the pastor of Wellspring of Life International. She is the founder and president of the Wellspring of Life International. She works with 3 chapters. Those are children with cerebral palsy and children with special needs, raped children, and teenage mothers. She says that she's also a debriefing counselor, and she deals with all types of traumas, because all the 3 chapters that we have listed are part of her stories. I hope we have gotten that. And also she works with women who have broken hearts. She's a mentor and she's a supporter. And also she's a minister of the gospel and preacher, and she's also in praise, and she's also a praise and a worshiper. And she goes to that church I've told you about, the Well Church. We go to the same church. And she's a mother of 3, 2 beautiful girls. One of the girls is called Betty. She's the one with cerebral palsy. We'll be discussing about her story today. And the other one is a handsome young man. I think I've met your son. All right, thank you so much, and welcome, Pastor Eileen, to the Better You Show. Do you have anything to add to what I've read?
All I can say that you have said it the way it is.
Wow.
Yes.
All right.
Done it good.
Thank you.
Yes.
Welcome, Ronald Kamau. Tell us about yourself before we start now our conversation.
My full name is Ronald Michael Kamau.
Okay.
Husband to Yulin, Rando, my wife here.
Yeah.
My lovely wife.
Wow.
And mother of my children.
Yeah.
We've shared life together for 22 years now.
Wow.
Yeah, so going to our 22nd year. We are blessed with 3 children, beautiful children. As you mentioned, our firstborn son is a man in his own right now.
Yes.
Yeah, recently married, and very proud of what the man is becoming.
Yeah.
Second born, Betty. She's pursuing a career in music. She's a blessing to many with her giftings and talents. Wow. And God is doing great things for her too.
Yes.
And the reason we are here, Becky, our last born, she's 9 years old, and she's a special needs child, and not just special needs, but she's also special. Special because since she came into our life, she has actually made us better.
Wow.
Yeah, having the opportunity to raise her and walk with her through this journey, cerebral palsy journey. It's been a challenge, but I'd say it has made us better people, better parents, better individuals, and yeah, we are going to be talking more about the journey. Yeah. And hopefully to get to bless other people too. Yeah. Who have gone through either something similar or know someone who are going through a similar case. Yeah. To be I don't know, but to be better versions of themselves.
Yes. Yes. Karibu sana.
Asante.
And I'm aware that you're in construction. Maybe you could just...
Yeah. So my profession, I'm a designer by profession, and my trade, I apply it mostly in construction work. So what I do is I'm both design and build. So a client has an idea or is considering building mostly homes, though I do also commercial projects. Whether in the hospitality, retail, finance sector, but I have a liking for homes.
For homes.
Yeah, so I say I don't build houses, I build homes.
Wow.
So somebody looking at building a home have no idea of where to start. Can talk to me.
Okay.
We'll walk the journey together.
We have Ronald for construction here. Now, let's talk about the story of Becky. Today my feelings are just mixed, but we will get there. So how did you find that there's something that really is different with her, and like where did the journey begin? Pastor Yulene, you could start with us.
Okay, the journey began when personally, when we got our 2 kids, the third one was bringing problems because I got into getting contraception and what, so it made me have a long duration of conceiving a child. So I'd even forgotten about it.
Yeah.
So Becky, it's God who brought her, because I actually nilistukia I'm pregnant after 2 months. It was a surprise. And the age also, that I was 38.
Wow.
So with the age and some things coming up, you're like, I can't get a child. But she came. So by the time she came, it was a problematic pregnancy. But we did not know we didn't know that when it's problematic, it will bring anything out of the ordinary.
Yeah.
So I had a rough time during my pregnancy. I was bleeding and all that. But this pregnancy moved to 10 months.
Yeah.
So in the 10 months reached, and I delivered the baby, 2.6 kgs, and she cried.
Okay.
So after some time, when it reached around, you know that time when you reach where the baby's head is falling, you're like, and then we had forgotten. So you see the age of Betty and Becky. Betty was around the gap, the age gap is big. Okay. So we had forgotten how a baby behaves and all that.
Understandable.
So when my grandmother came to visit, she was like, why is this baby at 5 months still the head is? It's wobbling.
Yeah.
Why? So she was like, I think you should go and check it out. So we were like, okay, fine. We went to a doctor. That's the first time we had cerebral palsy. And we were like, maybe it's a hormone, it's something. We never looked into it.
So when was this that you went to see the doctor?
When the baby was 5 months.
5 months?
Yes, when she was 5 months.
And
her head was wobbling.
And they told you there and there that it is cerebral palsy?
Yes, the doctor whom we saw just told us it was cerebral palsy. So we wondered what cerebral palsy was, but we didn't put it in our mind so much.
Yeah.
Now we started seeing, when she gets an infection, the skyrocketing temperatures, 40, 39. This week we're in hospital, this week she's okay, the next week we're in hospital again. So it started reoccurring.
Yeah.
The more she was growing up, yes, she's jumping around a little bit, but she was not walking.
Okay.
Jumping with one leg, laughing, she could tell, she could actually understand. Do you know that understanding you have with your child, even though she's not speaking, but she's wobbling, but she can understand. All that was there. So it began, she's not gaining weight.
Yeah.
She's not, so there are some things that were happening, and when she gets infection, it's too much.
Yeah.
It's too prolonged. And then it started now happening so much.
Yeah.
Frequently so much that now we're like, this is too much. So the doctor we went to told us, we've given this child antibiotics that are impossible.
Yeah.
Can we please go to a main hospital? That's when we were told to go to Kenyatta.
Yeah.
Now that is where now we started seeing things, because we were like, when she went to Kenyatta, when someone just came and carried her, we were like, what's going on? So we were so green that we don't know anything. So by the time that they're putting oxygen, they're putting things on her, we're like, what's going on?
And you left home carrying her.
Is going? Yeah, we're just carrying her. She had just a temperature. What's going on? But her temperature was too high. So like, what's going on here? She's being put things. We are seeing things being written on ting, 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 but you're not understanding. Then you would see the nurse standing up, going down. You're like, what's wrong with this nurse?
Yeah.
Then the time she just spit, and you're like, kumbe.
Yeah.
If we look at it now, her oxygen had gone down.
Oh.
Completely. It was around 10. It had gone to 10.
Yeah.
So that means she was leaving us. We didn't know. At times it's good to be not to know things.
Yes.
Because that time we didn't know.
Yeah.
But now we know. We look at those things like this. We know the temperature, oxygen, how to take. When they're taking things on her now, we know.
Yeah.
We're actually versed with a lot of things, and they have really helped us.
Yeah.
The nurses have helped us, the doctors have helped us to know what is happening, because we ask.
Okay.
It's good to ask. Be a person who asks and wait to be told. Then get to understanding and use your phone to get to understand things better.
Yeah.
So that is where our journey started. It started by us seeing the wobbling neck, then now coming, and then her being admitted.
Yes.
That the first time she was admitted just for a week. We went back home.
Yeah.
Then it became worse, and now we came, and now it has been 3 years down the line, and we're still in hospital.
It has been 3 years.
Yes,
in
going to
hospital.
the 4th year. Yes.
Okay.
Yes.
And how old? You told me Becky, she's 9 years.
Yes.
So this condition was diagnosed when she was, you told me 5 months.
6 months,
Yeah, 5 or 6 months.
So what are these, the physical aspect of her that may, or the milestones that he was not able to catch up as expected? I know we've spoken about the wobbly head. What else did you see?
Sitting.
Sitting.
Yeah, because she by around 6 or 7 months, I mean, she couldn't sit unsupported.
Yeah.
Yeah, you had to put some cushions to, yeah.
Okay.
So that was another concern. There was also something she used to do with her tongue. Yeah, she would move her tongue
Okay.
a bit, yeah. And we okay, you have to admit also, from us as a perspective, sometimes as a parent, you want your child to be okay.
Yeah.
That when you see certain things, there's a mechanism that you don't want to. It's like a denial.
I get you.
Yeah.
I get you.
Yeah, you say, because I remember having some guests over, and then I guess one of our guests pointed out, and have you noticed that your child does this thing with the tongue? And you're like, no, we're just used to it. She does that.
Yeah.
It's okay. She's been doing that. I think she does that. And we used to associate it with when she's passing stool. She's pooping. We used to say, she does that when she's pooping.
Yeah.
But then, like, so in a way, there was also something internally that was still not hadn't fully clicked.
Yeah, you wanted to tell yourself that things are okay, our child is okay. So that means that by that point you've not yet accepted how things are. So at what point did acceptance happen, and what did you do?
So when we went to the hospital, and actually what made us go to hospital was that I noticed her foot. She used to stretch her foot, and it would curve her foot in a certain way. And for me, I thought that would be, I think I'd come across an article on club foot. So I thought that could be an onset of club foot condition. Yeah. So that was what, and this particular doctor we went to was actually an orthopedic. He's an orthopedic doctor. He had actually just treated our son, the older one, for a knee injury from playing basketball.
Yeah.
So we thought, we already know an orthopedic. Let's go to him.
Yeah.
We went to Dr. Kingori, and when I explained to him what our concerns were, and we were all there, the entire family.
Yeah.
That day was a big day for we had all our children and the two of us.
Yeah.
And so Dr. Kingori even dictated 5 minutes. She just did some physical examinations.
Yeah.
On the knees with the kahama thing. And then he stood up and told us, has anyone ever told you that your child has cerebral palsy? That's the first time we had it.
Wow.
At least, concerning our child, because she had been to hospital several times for other infections. Yeah. But nobody had ever told us that.
What age was she at that point when you got?
6 months.
Oh, 6 months.
6 months, yeah. So, wow. So that's the first time it was put to us that this is what you're facing. And as a family, tukakuwa na kamkutano. And we said, okay, we don't know what this is, but I think we have an idea. But since we've been told, we are going to deal with it as a family. Yeah. And our children, the elder children have been so supportive. They've been they have been more than their siblings. They have filled the gap when even us sometimes we felt inadequate. They have been there, and and the journey just up to this point now. And for us, we said, okay, we'll manage. We at first, when we were told that, we started our own physiotherapy. Yeah. Just to deal with the stiff joints and the muscles.
Yeah.
So, and interesting, even before that, when she was born, we started massaging her without knowing.
Wow.
We used to massage every day.
Yeah.
So I don't know whether that helped, but I guess it must have helped. But we didn't know what we were doing. It was just something we used to love doing after birth.
Yes.
Every time, whoever did, whether it was me or the mom or the brother, the sister, whoever bathed Becky, would end up with a massage and then she would sleep.
Okay. I'm just thinking now, as the father of Becky, how did you feel, from that point of, okay, I'm the man, I'm the father of Becky. How did you truly feel, so that you encourage another father who is watching and maybe they've just gotten that diagnosis, and also to tell them what it is from that aspect of a husband, of a father, and as a man? Yeah.
Well, it was difficult. It was difficult. I remember at that time I was studying. I was studying for my masters, which I didn't complete, but but I was in class, and they had gone for this checkup at Gertrude's.
Yeah.
And so one of the things that came out was that she had the spine had an abnormality, and yeah, so some of these things, so this information was coming in bits and pieces, and it took a while, not finally get the full picture.
Yeah.
And I remember asking myself once that, asking myself why.
Yeah.
Yeah, that question, I asked myself why. And then it was interesting because I got an answer almost spontaneously. I asked myself why, and then why me?
Yes.
Why us? And then the answer was, if not you, who? Yeah. So okay, you didn't want this for yourself.
Yeah.
Yeah, and so it's not your choice. But so if not you, who?
Then who?
Yeah. You do want this for anyone else?
Yeah.
I said, okay. So that really helped. That having that constant conversation with myself.
Yeah.
And also definitely I have to, as you mentioned, as you had my wife mentioning, our grandmom was a really big support system during those initial months, and just encouraging us, and family just encouraging us, and I mean, just to accept that it took interventions of a lot of people.
Yeah.
And that's also very important. I've come to hear that family support, that support structure, is very important. Even when you don't understand what's going on, just having people around you who are encouraging you and are telling you it's going to be okay.
Okay. What do you tell a husband who is in the same situation as you? Should they now think like it's a mother's problem, it's a child's problem, or it's...
Some of the phases that you can go through. So that discussion happened. Is it from your side? Is it from my side? Okay. And mostly it's out of ignorance, because like in this case it's neither.
Yeah.
It's neither, because when you understand cerebral palsy, then you understand the causes of cerebral palsy. Then you understand it's neither. It's not about this side.
The wife or the...
Yeah, this is a chance occurrence that would happen to anyone, and ikikuja you accept tu you move. I think blaming, it's very easy to blame. It's very easy to deny, or to I mean, some people will even go to the extent of abandoning their families and their children, and it's unfortunate, because for us, Becky has been a blessing.
Wow.
Becky has been a blessing. She has taught us so many things. She has taught us to be patient,
Yeah.
She has taught us to be joyful even when things, because that's one thing, trait of Becky's. She apart from now she's going through a phase, but she's always been a joyful child.
Yeah.
So even when things seem so dark,
Yes.
she just smile and uplift you.
Yeah.
Yeah, and she's
Wow.
been a blessing.
Wow.
Yeah.
Thank you so much for sharing, Ronald, as a father and also from a perspective of a husband, that when this happens, we are not blaming either party. We are not blaming the mother. We are not blaming the father. It just happens. These things just happen. So what you're going to do is that we're going to take a short break, and when we come back, the nurse is going to join us, so that now we get to understand cerebral palsy from the clinical aspect of it, and also from an expert. Stay tuned. Welcome back to the Better You Show. We have been having conversations about cerebral palsy. The first part, we had a conversation with the parent about the child called Becky who has cerebral palsy. As we always say at the Better You Show, we like to engage with experts so that you can be able to trust what they are sharing. And the expert that we have today is a nurse. And her name is Maureen. She is a Kenyan registered community health nurse and a proud alumni of Baraton University, where she earned a Bachelor of Science degree in nursing with 18 years of extensive experience in the nursing field. She's currently serving in the pediatric department at the busiest national referral hospital, we know it, the Kenyatta Hospital, providing high quality, compassionate care to the children and their families. She says that her professional journey reflects a strong commitment to excellence in healthcare. She also says that continuous learning and dedicated service to the community is what drives her. Welcome to the show, Maureen.
Thank you very much.
Is there anything I have left so that you can add to your introduction?
That is very well done. Thank you very much.
Okay, thank you so much. Welcome to the Better You Show. Now, this second part, we really want to hear from you so that you give us the clinical perspective of cerebral palsy. The parents have really shared a lot about the condition. Now, we want to understand, what is cerebral palsy?
Okay, thank you very much.
Oh, by the way, there's something we've forgotten to do, and you're not running away from it.
Which one?
Pastor Eileen has been waiting. Give it to her. That is a tongue twister of the show.
My friend.
Let me give you...
I was thanking God you had forgotten this one.
No, we have to do it. Okay, you have 2 seconds. You interact with it.
Now,
Yeah, I know you're ready. It's short. Okay.
Hi.
Pastor Eileen, she's the one who's you're going to give us marks.
Yes.
You give us score. Okay, take it on.
You can do it.
Stiff joint struggles, soft stretches, soothe, steady steps, strengthen, shaky stance.
Faster, faster.
Stiff joint struggles, soft stretches, soothe, steady steps, strengthen, shaky stance.
Okay.
Wow. She's
Pastor
done
Eileen,
good.
how
She's
did
done
you
well. She's tried. She's done well. She's done well.
Thank you very much.
Sawa, sawa, asante sana. Now, what is cerebral palsy?
Now, cerebral palsy is a brain disorder. It's actually a group of disorders. It's not usually one term, one definition, but it's a group of disorders that affect the brain, that appears in infancy and early in childhood. And it permanently affects the body movements and the muscle coordination.
Okay.
The words themselves, cerebral refers to the brain, and palsy refers to weakness or problems with muscle use.
Okay.
Yes. And then it's a group of disorders, just as I've said. It's not a single diagnosis. It's an umbrella term that refers to many various conditions affecting movement and posture.
Okay.
And then it is not progressive.
Ah, okay.
The initial brain damage does not get worse over time, though it might affect the body in many other ways in future. If it is mainly about the muscles. So if you don't use the muscles, they'll atrophy and do other things.
Okay.
But the main cause of the disease is the brain damage.
Brain damage.
Yes, it occurs. It is an abnormal brain development or damage to the developing brain that occurs typically before you deliver the baby, during delivery, and it can occur shortly after birth.
All right, just let's understand this. I really want to understand this.
Okay.
It can happen before, during delivery, and after delivery.
Yes.
So what makes it to occur in those 3 ways?
Okay, during delivery, during the abdomen, the baby might have intra bleeding in the brain when they are developing in the utero.
Okay.
Yes, and we may have maternal infections that may affect the unborn baby.
Wow.
So it's good for the mother to go to clinic and let's see the profiles when the mother is having the baby.
Okay.
If it doesn't occur before delivery, it may occur during the process of giving birth.
Okay.
We will look at it when we refer to traumatic birth, injury and all that, and lack of oxygen to the brain may cause damage to the brain tissues.
Okay.
And then it can also occur shortly after birth when the baby gets now infection and other things that we will also look at in this conversation.
Okay.
So for cerebral palsy, it is the most common motor disability in childhood.
Okay.
And neurologists, the specialists who take care of these children, they say that cerebral palsy is mostly related to prematurity of birth. Babies who are born before their term.
Okay.
A term is 40 weeks delivery,
Okay.
and some of them have low birth weight, and some of them are extremely low birth weight.
Yeah.
And we are talking about birth weights below 1.5,
okay.
according to the WHO. Yes.
Okay.
Some of them may come with that, whatever.
Okay.
Yes.
So now my question then is, based on what I'm hearing, that cerebral palsy, the parent, the mother, has no contribution to it. Because if it happens in the tummy, in the womb, because of bleeding, right, and through traumatic births and after, so it means that there's nothing, it's not an error with the mother.
No, we are not literally saying that, but we are saying there is an aspect of the mother that can bring the cerebral palsy to the unborn baby.
Which ones are those?
Which one? The ones I talked about, maternal infections.
Okay, for example, which infection?
There is one called cytomegalovirus.
Okay.
There's another one called toxoplasmosis. If it occurs in the mother, it's a virus.
So those are just infections that can come when you're pregnant?
Yes, because
okay.
the pregnant mother, we assume, has a partner who is sexually active. Some of those infections appear when there is a sexual contact with the partner.
Okay.
But now when the mother has those infections, it can affect the unborn baby.
Yes.
So when I go to other causes is maternal infections that affect the unborn baby. We may have stroke, which may affect the blood supply to the developing brain inside the birth.
Yeah.
If the mother has high blood pressure and there is a stroke happening inside, even the little one may have a interrupted blood supply to the brain.
Wow.
Then we have bleeding in the brain is something which can occur in the womb, even before the baby is born.
Yes.
Then we have, now when the baby is born, we have infant infections.
When the baby is born?
Yes, immediately we have the infant infection. They may also cause swelling around the brain. Remember we talked about cerebral palsy as damage to the brain tissue.
Yes.
Yes, and it's a permanent damage. It is irreversible. Yes, yes, it is. It is not progressive, but it's permanent damage to the brain cells.
Okay.
So another cause could be traumatic head injury, which can occur during delivery. Yeah, when the prolonged labor and difficult delivery,
Yes.
we advise young mothers the first time they give birth to go to big hospitals where they can be rushed to theater.
Okay.
Yes. When they have, the midwife is not able to tell if the mother is having difficulty labor,
Yeah.
that is when most of the damage comes to the brain. When
Because what do they lack at that point?
that time, the mother is forced to deliver, and you know those external forces to the uterus is forcing the baby to come
Okay.
out, and maybe the pelvis is small and the mother is unable to give birth. So there is injury to the brain, and it will affect the baby and oxygenation circulating in the uterus.
Okay.
So lack of oxygen, as I've just said, is one of the difficult situations when we have hard labor, difficult labor situations.
Yes.
We call it the first stage of labor,
Okay.
when the mother has prolonged labor and difficult delivery. Although this one is one of the least possible. Yes, others are more advanced.
Yes.
Now, when the baby gets cerebral palsy, you told me to talk about the extreme, the severity.
Oh, the severity, like are there
Yes.
categories
Yes.
of cerebral palsy?
Yes. Usually, let me just say simply, there is the mild phase and the extreme. There's severe form of cerebral palsy.
Okay.
But there are the types of cerebral palsy.
Yeah.
Before we go to the types, I like to explain about the mild type. You will not see the symptoms that we will be talking about today. But with the severe type, we might go into even using equipment to support the patient.
Okay. Let us now discuss about the mild category of cerebral palsy.
Okay. The symptoms of cerebral palsy might be mild. We may not see much of it was difficult even to know.
Yeah.
Remember, the parents said even at 4 or 5 months they were not able to tell if the baby is holding the head up.
Yes.
And someone had to tell, the grandmother had to tell the story
Yes.
about that. With the mild versions, you may not actually pinpoint this is a cerebral palsy, and it's difficult to diagnose.
Okay.
Yes. There are some cerebral palsy that affect the whole body. That is muscle disorder in the whole, affects the whole body. Some it is part, some is half of the body, some it is just a few aspects of losing muscle tone in the body.
Okay.
And we are talking about trouble with movement. So you see the baby has jerky movements, uncoordinated movements,
Yes.
or they are floppy, and the coordination is not there. You will start seeing the baby not able to sit, walk, stand, and all that. And when they grow up, the speech is delayed. They are not able to catch up with speech. They are not able to eat.
Okay.
And developmental milestones, as we have said, they'll be delayed. The head will not be able to, the baby cannot support the head on herself, cannot be able to sit up on herself, will need a lot of support.
Can they say mama, baba, or?
It is difficult because it will also affect some speech.
Okay.
Some babies may affect speech. And then with cerebral palsy, it varies with patient to patient. Some it will be severely effective, others may affect it in a mild form.
Okay.
Yes.
And for the severe?
Severe, now we have the major movement and coordination is visible.
Yeah.
Like we have stiff muscles, exaggerated reflexes. Instead of doing this, they do this, they turn, and there's non-spasticity. And this is most commonly movement related to the cerebral palsy.
Okay.
We have the stiffness and the reflexes are very stiff. You see someone has a lot of stiffness, and those ones are now for the severe cases. But the variations in muscle tone may also occur. Some are stiff, others are floppy.
Yes.
So it presents differently in different patients.
Okay. Now that you've mentioned that it is permanent, there's no cure, so what are these therapies or intervention that can make their lives better?
Okay.
Yeah.
So these patients with cerebral palsy need a lot of support, and one of them will talk about the physiotherapy.
Okay, physiotherapy.
Those are the usual simple exercises for range of motion. Like if I don't use my muscle, it will atrophy.
Okay.
It will crumble, it will atrophy. So the physiotherapy is the one who comes to rotate the muscles, to flex the muscles, so that the normal ranges of the hand, the foot can be maintained while the baby, the child is going through the illness. So there's physiotherapy, there's occupational therapy.
Okay.
They are taught how to hold things, touch, and there is oral speech therapy. They are taught how to talk. There's a nice mechanism they use at electrical brush, toothbrush like form, to stimulate speech. And the baby is able to form rounded words. And with time they'll be able to say mama, bring a cup, and hold a few things. In training, they use the multiple colored boxes, able to move this box to this box. Is the baby holding the hand well? Those are the work of the physiotherapist and the occupational therapist.
Wow, okay.
Yes.
So now, Pastor Yulin, because I'm sure you are relating your journey with what the nurse is saying, Nurse Maureen, which one have you seen has been effective with Becky, that when she goes through this therapy, at least there's progress?
The one we've been seeing, she's been undergoing the physio. She's been undergoing both the physio and the occupational. But the occupational, we used to do it ourselves at home, and she would gong at the cabal that time. But right now where she is, as you have heard, she has said there are stages.
Yes.
Now when you speak about the stages where Becky is, it's like she's in the last stages. So there's no movement the way it was before because of where she is now. Before she had movement, but now it has deteriorated because you've had atrophy, and it's also in the brain, according to what the nurse has said, which we understand so well, because they've been there for us to teach us and to take us through this journey from the beginning. And we are happy with what is there right now. Because when you talk about senses, that is what now you are using. Because if she's not seeing, you touch. If she's not hearing, you also have the touch. When you feel, she knows who is there, who is not there. According to what she's saying, we have actually gone through her movements, her physiotherapy. They do it to her daily in hospital. That one is there. There's occupational, which is not now for her right now. But the physio is what is happening right now for the legs, to just make her blood be stimulating, you know? Yes. At least, and for her to be okay, not to get maybe things happening on her body or something, getting an chipuka or something. Yes. So physiotherapy is what is happening to her right now in the stage where she is. Yes.
So now for you, as a mother, what have you seen that Becky loves? And also number two, how has this journey affected you?
What Becky loves?
She loves,
Becky before used to love worship. She would hear a song, Jesus, you love me too much. She would even, there was a time she was not doing anything, but when you'd see, when that song would just be heard, there was a time she was not there, that's what I can say. But when that song she used to hear, she just came back. And she'd put her hand up.
Wow.
Because of worship. So worship, actually music, we came to discover music has a lot to do with these children. My daughter does music, as my husband said. She plays violin. So when we used to be at home, Becky would play violin, it would really go well with her. She would actually coordinate and listen, and even you hear her humming. So worship does a lot.
Wow.
Worship does a lot. That's what we discovered with these children. Worship. Worshiping God. And she loves so much. She has music, she does. But now as she has been going and going, I believe when you give her these things before and where we are right now, I believe that is what is running in her. So what you give a child before and even this time that it's going to the stage where she is right now, they are running in her mind. She would watch cartoons, biblical cartoons. She would actually hear the time. There was a time she was not seeing, so she was hearing. And there was a time she was seeing, so she would be watching. But you see, these are things that will not stop being in her, even though right now she's not hearing or seeing. So we are happy because she knows people are there with the touch that we are having, with the physiotherapy that she's having. So we are happy with that and contented. And how are we feeling? How we are feeling, we look at it like, I'm one person who's very positive. I take everything positively. And even we have nurses who talk to us. You know, we also undergo traumas. It's not a joke when you're seeing your child. You know, the situations that happen, like the last one she had was not interesting. Like maybe she was not pooping, she's not urinating. It reaches that point that is not happening. Her stomach has swollen up. Now you don't know what she's feeling. Is she feeling pain or she's not feeling? She's being pricked with a needle, she's not feeling. No pain. No pain. But you're seeing as a parent what, how. So all that passes through your mind, and then you see where it was from when it started to now. You go into, that time you want your husband to talk to you, he's not talking, he's going through his own thing. And then as we're a family, we have been there, all of us. My husband, my daughter, all of us have been there. We are watching, even my daughter, my new daughter-in-law, we are all there. So we work as a family. Number one, you have to work as a family so you don't carry the burden alone. It is very important. And then keep talking. Don't keep quiet. Talk to the nurses. And they're there to talk to us. They are normally there. People think that Kenyatta is bad. It is not. I will assure you, it is the best hospital I have seen so far. We have been there, comfortable. We have not left. And you're seeing her here. If she was not good, she would not have stepped here. It's true. It is true. So when people say that Kenyatta is not, they're lying. They are good, they've been with us, they've worked with us, they have taught us, we know how to use what. Like now we are confident even as we're going to leave, because Becky is supposed to be discharged, and we're so excited. And we're happy about it. We know what to use. The suction machine, the oxygen, we have been taught. So we are so ready. And we are confident. And we are happy because God has given us a good time with her, rather than not. Because she's 9 years. We are celebrating God every day. For her life. When we thought she was going, she came back. When we thought, I saw he Meisha in the ICU, she came back. What gives you the strength? The strength is just seeing her breathing every day. Even when she's not there, because there was a time she was even not there for 4 weeks. You don't know what is happening in her head or what. But she was there breathing. You know, at times you just want to sit and tell God, thank you for she's breathing. I'm telling you, Becky's life has changed us. We've had shaky stance. This shaky stance is what has built our muscles inside to make us know that life is what you have every day and what you value every day. What you look at and say, wow, she's woken up. Even that's what we ask. Ameamuka? How is she? She's okay. I mean, she has long hair, so it's plaited. There are many things to look at and pictures to give her. Before she used to smile when she would see pictures, now she's not. But those pictures are still there. So the stories continue. And then there's another lady another time at the hospital who told me, do you know, Mama Becky, we are very lucky to have children that God has blessed us who will go to heaven. Because they have no mistakes. Amen. So I looked at it, I was like, ooh, that's weird, but it's the truth. We are a carrier of heaven warriors. So I thank God that He chose us to give us this, because, and that's why I said, the show is called The Better You. Becky has made us the better us, whereby we are speaking this, not to shame, because people call it cerebral palsy, ugonjwa uchawi. Some people have left their wives. My husband is there. Some people have society is not taking in these children. It's not seeing as though they are people, but I've come to tell them they are children, they are beautiful, and they even carry our blessings. People don't know. They carry our blessings. We are blessed. I cannot refuse that. We are blessed and we have seen it happening. Thank you so much. And as we come to a close, I just want to understand the care management. Now that Becky has been discharged, we are very happy that has happened. So how is the management process of cerebral palsy, Nurse Maureen?
Okay. when we take Becky home, we are talking about the cerebral palsy with Becky went to the severe end where she could not swallow. So she has a PEG tube, a G tube. It's called a gastro tube for feeding, right where the stomach lining is. There's a tube for feeding.
Yes.
And it also affected her breathing because of the collapse of muscles around the neck and the swallowing reflexes.
Okay.
She was given a tracheostomy tube. So she's breathing through a airway pathway around the throat.
Yes.
It's called a tracheostomy.
Okay.
There's a care towards that tracheostomy, and now we have to take care of the feeding even at home, even the same way we have been doing in the hospital, is the same way the nutritionist will plan her daily intake.
Wow.
And it has to be blended food, rich in vegetables and protein and all that, and take care of the calcium to build the bone strength and all that. And all that vitamin D, every food that is rich in vitamin C, calcium and D, vitamin D should be added in the diet for Becky to have strong bones now that she's not using them most of the time.
Thank you so much, Nurse Maureen. Thank you so much, Pastor Yulin. Thank you so much, Ronald, for coming to the Better You Show. Because of you, we've really gotten more insight about cerebral palsy. And as we close, I would like you, you start with Miss Maureen. What message of hope do you have to parents who have children with cerebral palsy? You can use that camera and talk to them.
Okay, I'd like to talk to parents out there with children with cerebral palsy. This is not a damage, a permanent situation. It is permanent disability, but we have to fight for these little ones. God did not give us these little children so that we give up. We have to be strong and courageous. Just like Joshua was told in the Bible, be strong and courageous. God will fight every battle, and every day we will see, every day you'll see goodness and mercy follow you. It's not time to give up for these little ones. It's time to hold on and soldier on. Parents who have left their partners because there's a cerebral palsy, it is wrong to leave your partner. We have seen a role model family of Mama Becky and the husband who has stood with her through the journey. It is not easy. No one will promise you it is easy, but we are going to be there for you. The medical fraternity, the clinical people will stand with you and support you through the journey. There are other complications that come, but there's medication we can give for anticonvulsions, epilepsy, anything that will be associated with cerebral palsy can be supported by the medical team. Follow up your child with the neurophysicians. Most of our hospitals now in Kenya have. We have 3 pediatrician neurologists in our hospital who can give you advice and see you in the clinics. You don't have to be admitted. Just keep up with the clinical follow-up. Our children at time they need a wheelchair to walk here and there, and don't lock them in the house because of disability and stigma. Just take them to church, let them sing praise with the others, interact with others. They are able to do 1-2 little things where they are able, especially with a mild form of cerebral palsy. So we ask you to soldier on. We are here, we are moving together. In the community, we also have support groups where women come together with children with cerebral palsy. And I think Mama Becky will be sharing with us more about such.
Wow. Yes. Thank you so much. Now to you, Pastor Yulin. What word of encouragement do you have for a fellow parent or also a fellow mother?
Wow, the word of encouragement I have is that we need to have love. And love, above all, love is what we need because these children need love. Many people don't, because of what happens, you stay in hospital so much, you feel like you're not seeing whatever you go through, you feel like what time will you have to love? But when you go to God and ask Him to teach you how to love, you'll be able to love because you know this is an angel of the Lord that God has given you, who needs love, and you need even love from them. Because when they smile, you smile too, you feel good. Even at that point, it's painful, but the person is happy. So the only thing I'll encourage is let's have love. I have Wellsprings of Life International, whereby we meet up, we come together, we just come with what we have and just rejoice and love on God. We're going to give out our numbers out there, whereby you can communicate with us, and we see what God has for us, even during this journey, which is a good, tough journey, but with God.
Thank you so much. Now to Ronald, what message do you have for a father and a husband who has a child with the cerebral palsy?
Yes, I'd just like to encourage them. It's difficult, yes, but as my grandmother used to tell me, that God won't give you a task that you're not capable of handling. So if you find yourself in a situation like this, please take heart, be encouraged, and be an encouragement to your spouse, because it's equally very difficult, especially that mother, because mother takes the burden of bringing the child forth. So you can imagine how hard it is for them. So just being supportive, encouraging them, and in that process, you'll also find yourself being encouraged and strengthened to be the best version of yourself.
Yes.
And I know financially it's draining, financially, emotionally, in all aspects, physically, and it's good to have people around you who can encourage you, who are positive. Definitely, I mean, as Christians, we have our prayer groups, and for me, I mean, people I work with have been very supportive. I'm told of prayer groups that have never been attended, that have us in their prayers every other week, and it's encouraging to hear that. And now that we're having to share some positive news that Becky's coming home, like today, it's amazing. It's been an amazing journey, and there's still some bills to be paid. So we'll be sharing a pay bill. We're doing some fundraising to be able to cater for the bill. It's enormous. The hospital has been very supportive. They have not harassed us. They have been very patient with us, even to allow us to go home as we organize ourselves to cater for the bill. So yeah, all that support we need, and that should be available to everyone. The government also needs to do their part to see that children with these cases are catered for, even within the new SHA arrangement. Yeah, so that this is handled. It's a long-term condition, as you had. It's a permanent condition and requires to be managed continuously. So a lot of support is required, and families are struggling out there economically. So any support, emotional, psychological, material, financial, it will go a long way in helping families to go through this.
Yeah.
Yeah, definitely.
All right, thank you so much. And on that aspect of funding, as you've heard that their child, she's 9 years old, and today she's being discharged from Kenyatta Hospital to go back home, and they need to do the care management at home, and it requires a lot of resources. They also have left a lot of bills there at Kenyatta Hospitals, and of course, at some point, all of it has to be cleared. So here we are just requesting if you could support Becky. Support her journey, support her recovery. When I say support, I mean financial support. And I'll just give Ronald a chance again to say, how can you support her? Where can the money be sent to? Is it a mobile number, or where can someone support Becky?
Okay. So we actually, right now we are setting up a pay bill number. I'm in communication Safaricom, so we still, maybe by the end of the day we'll have it. But our number, my number is 0727 835 210. My wife's number is 0791 08 8764. So through either of those numbers, you can get in touch with us, and we'll have more details on how you can support us. And we'll be sharing with Sianto the pay bill once it's out. We'll be sharing so that you can share with your viewers.
And we would like to thank the fraternities of our schools, Dagoretti High School, Pangani Girls, where we have been, and the Well Church. Our pastors, George and Sheila, have done a good job, and Sianto too. So we thank God even for this privilege of being here. We don't take it for granted, and we say thank you.
Design alumni, University of Nairobi. We've also been very supportive, my former comrades. And yeah, it's been amazing. It's brought a lot of people together.
Wow.
Yeah.
Amazing. We have come to a close of today's conversation, and we have learned that courage is actually not loud. Courage is a parent praying for that child. Courage is a parent lifting up that child. Courage is a parent who keeps on going for those overwhelming visits or appointments at the hospital. Courage is worshiping with that child. And as usual here at the Better You Show, we say that be kind to yourself and to others. And because we have said that worshiping is part of courage, Pastor Yulin, she has a wonderful voice, and we want to dedicate this song to Becky because I hear she loves this song. So we are just going to take a few seconds or even a minute just to sing together.
Yeah, we just want to say thank you, God, because today is when we received the news she's coming out of the hospital, so we are saying thank you to God.
Yes.
Nimekuja kusema asante, nimekuja kusema asante, tumekuja kusema asante, tumekuja kusema asante, asante. Asante, tumekuja kusema asante.
Nice, thank you so much, and see you soon.
Thank you very much.
Bye.